And also thank Rajal for all the work, and Sandra, all of the work that has been done to actually make official a Portuguese version that's been validated and is now on our website. And the talk that I'm going to be addressing today is where we started, which fortunately I can give details that probably no one else can because I was there at the beginning. And I think more importantly, where we're going. When I first started this back in 1994, I had no idea how a simple idea, working with people who basically pushed me to do additional things, which I'll explain some of those stories, some dietitians in my history who have given me some very good advice over the years. But I'd like to ask a few questions of you. Some people know a little bit about me. I actually trained in medical oncology, trained and practiced in surgical oncology, and then also have a PhD in nutrition. And I think it's been that combination that has made all the difference in this. But now I need to know a little bit about you. How many of you are dietitians or nutritionists? Okay. How many of you are physicians? One in back. How many of you are nurses? In back? Okay, we've got all the people who are non-dietitians or nutritionists in back, it looks like. Any physiotherapists? And anyone I didn't ask? And knowing what your background is, if you look at the people up here, I'm sure you probably recognize some of your patients, but I also recognize some of my family. And a lot of times people ask me what makes me so passionate about what I'm doing and why I think this makes such a difference. And the man and woman in the middle are my mother and father. Unfortunately, neither of them are with us anymore. My mother there is the one, if those of you who had your coffee this morning or your tea, on the side here, the woman with the white blouse, that's me, a few years ago, a little bit younger, but about the time that I was doing some of the work about developing the PG-SGA. And what's interesting is my mother had breast cancer, and many times you know that women will have a 50-50 chance of increasing their weight rather than losing weight. Unfortunately, hers came back and she did very well for almost 20 years, and then she came back with it in her liver. And during that period of time, she lost a lot of weight. And that picture, those two pictures, are a matter of, this last one was about 6 weeks before